everyone. Today we are going to learn the acupoint of non-meridian of hand Taiyin. The details are as follows. Area 5 was located in the transverse creases of the elbow and in the radial fossa of the bicep tendon. Generally, we can easily find the elbow transverse creases, but how to find the tendon of the bicep or brachii? When we bend the elbow and shrug the biceps, we can feel the bicep tendon in the transverse creases of the elbow. And area 5 is in the radial fossa of the bicep tendon. In other words, the fossa is area 5. At the C point of non-meridian, the therapeutic effect of it are as follows. As the C point of non-meridian, firstly, area 5 treats the disease of the lung system, especially non-related excessive syndrome, including cough, asthma, hemoptysis, sore throat. Secondly, area 5 has the local therapeutic effect since it is located on the elbow transverse creases. This point can treat elbow and arm pain. Thirdly, it also treats some acute disease like acute diarrhea, heat stroke, infantile convulsion. Area 5 is clinically widely used. Next, we should introduce the acupuncture on this point. Generally, we insert the needle perpendicularly for 0.8 to 1.2 chun and make sure the patient feels the qi sensation. For some non-incisive heat symptoms or heat stroke or other emergencies, we can do pricking blood knitting on area 5. The second acupoint we will introduce is cleft point of non-meridian, area 6. Area 6 located on the front of the forearm, 7 chun above the transverse creases of the wrist. On the line connecting area 5 and area 9 has been located before. Area 5 point is on the elbow transverse creases and in the radial fossa of the bicep tendon. Then, we should know the location of area 9. It's on the distal part of the vertical transverse creases, where the radial artery beats. Then, we draw a line connecting area 5 and area 9. On this line, 7 chun above the vertical transverse creases is area 7. We should how to define the 7 chun. The distance between vertical transverse creases and elbow transverse creases is regarded as 12 chun. On this line, 7/12 above the vertical transverse is the location of area 7. Since she-cleft point can treat blood syndrome and acute disease. As area 6 of non-meridian, firstly, it treated acute disease of lung system, including nosebleed, hemoptysis, coughing blood, and other symptoms of the lung system, like cough, asthma, sore throat. Meanwhile, for the local therapeutic effect, area 6 can treat meridians and activity collaterals. To reveal elbow and arm pain, we need to emphasize that as the she-cleft point of non-meridian, area 6 has a very special therapeutic effect about non-related blooding disease, such as nosebleed, hemoptysis, coughing blood, and so on. It's very simple in clinical operation for area 6. Step 0.5 to 1 chun to achieve the qi sensation. Next, we introduce area LU10, the in-spring point. It is located on the lateral side of the hand at a red-white flesh border, and on the medial point and radial side of the first metacarpal. Firstly, we should locate the red-white flesh border. Then, seek the red-white flesh border. The red-white flesh border is on the joint between the hand plane and the dorsum. Then we can find it, and at the middle point of the ram side of the first metacarpal bone, we locate the LU10 point as the in-spring point of hand Taiyin. LU10 can treat the excess heat syndrome of the lung system. Basically, in-spring point treats body heat for its body reviewing function. LU10 can treat some heat disease of the lung system, such as cough, hemoptysis, dry throat, sore throat, and aphasia. The second function of LU10 point is the locative therapeutic effect, which can treat the pain around the palm, as well as palm heat. Besides, LU10 point has a very special therapeutic effect, treating infantile malnutrition. Clinically, LU10 point should be perpendicularly leading for 0.5 to 0.8 Chun. What's more, incision therapy can be applied when treating infantile malnutrition. Among the non-meridian acupoints we introduced today, LU5, LU6 can be treated hemoptysis. LU10 acupoint can treat sore throat. Hope you can master the location, indication, and acupuncture operation of these acupoints after class. That's all for today.